All right, thanks everyone for joining us today. We'll get started. So today we're going to be discussing how St. Vincent Hospital is rebounding after a nursing strike, something that's becoming more common at hospitals across the country. My name is Iman Abu Zaid. I'm an MD by background, and I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for healthcare workers in the US today. Incredible Health is the only platform that allows hospitals to hire permanent and experienced nurses in 20 days or less. We flipped the script, so hospitals and health systems are applying to the nurses instead of waiting for the nurses to apply to them. Joining us today is Jay Prosser. He is St. Vincent Hospital's Chief Nursing Officer. St. Vincent Hospital is a regional hospital serving Worcester, Massachusetts since 1893. The hospital has received several awards from the American Heart Association this year, including their Get With the Guidelines Stroke Gold Plus Quality Achievement Award, the Target Stroke Honor Roll Elite Award, and the Target Type 2 Diabetes Honor Roll Award. It's been named a Best Regional Hospital by US News and World Report, which also awarded St. Vincent the highest possible nurse staffing rating and earned 6 high performance awards. Jay is an Alabama native. He's been working in healthcare for the past 20 years. He's held several nursing leadership positions at various levels from previous experiences. He joined St. Vincent's 8 months ago and previously served as Assistant Chief Nursing Officer at Brookwood Baptist Health in Birmingham, Alabama. Thank you so much for joining us today, Jay.
All right, thank you very much. Glad to be here.
Great. So this is designed to be an interactive discussion. For those of you in the audience, please feel free to ask questions in the chat and we'll answer them as we go along. There will also be time at the end for Q&A that we've dedicated. And we're also recording this, so a member of our team will be in touch to share the recording with you as well. So today we're going to be covering the state of the nurse labor market in the US. Then we're going to cover the topic of why nurses are striking, how St. Vincent Hospital is rebuilding the nursing system after their 10-month strike. We're going to be discussing the topics of nurse hiring and retention, and then how Incredible Health can help, as well as Q&A. All right, let's get started. So let's do a quick market overview, just so let's set the stage here so everyone's aware of what's going on in the US nursing market. First is that our demand for healthcare as a country continues to increase, right? Our population is aging, but the supply of workers has not kept up with that demand. It's true in nursing, it's also true in many other healthcare professions. In 2018, healthcare became the #1 labor sector in the country by number of workers, and 1 in 8 Americans now works in healthcare. Now, this shortage, this demand that's increasing, but the supply of workers isn't meeting the demand, is creating quite a significant shortage. And we are on track to be 1.1 million nurses short by the end of this year. The annual acute care nurse turnover on average in the country today is 18.7%. Now, we work with some health systems that are much lower than that. We also have health systems that are higher than that. So that is the national average. It has gone up, right? It has gone up by about 2% during the pandemic. And then labor as a percentage of revenue is 48%, and that has also increased. So every hospital and health system in the country is experiencing increasing labor costs. That's not only coming from the premium labor, but even the wages of the permanent healthcare workers and the permanent nurses is also going up. And then we are, on average, it's taking 82 days to fill a permanent specialized nurse open role. That's the national average. Jay, I'm guessing these are pretty consistent with what you're seeing and experiencing too?
Oh, absolutely. Yeah, it's pretty daunting when you look at the entire high aerial view of it, but absolutely.
Oh. All right, so I did want to also just share just some data from our platform. We work with about 10% of US nurses actively use Incredible Health. There's 400,000 of them on our platform. And one of the questions we ask is why are you changing jobs? Like, why are you considering leaving? And we've listed the reasons here. These are the top 4 reasons ordered in order of priority. The most common reason is they're looking to advance their careers, right? And that can come in many forms, like they're trying to specialize more, they're trying to expand their skills, they're trying to move into management, they're trying to cross-train. And so looking for career advancement opportunities is often the #1 reason. The second most common reason is they're looking for a more flexible schedule or some kind of better balance between their work and the rest of their life. The third most common is something to do with geography. They're trying to reduce their commute time or they're relocating. And then the fourth most common is they're looking for higher pay. Now, we work with many nursing leaders and HR leaders across the country. There's a lot of attention on the pay and the compensation piece, but we hope that, but there are systems that are really starting to put together strategies and tactics that tackle numbers 1 and 2 in particular, because that is driving, addressing number 1 and 2 there, advanced career advancement and more flexible scheduling, usually improves retention and improves hiring too. All right, so I'm gonna pause the slides, and I want to really focus in on the topic of nursing strikes first, because that's one of the main reasons why many HR, nursing, and operations leaders from across the country have joined the webinar today. There's been at least 14 healthcare worker strikes in 2021, and at least 10 so far in 2022. And over 70,000 healthcare professionals have participated in these strikes. St. Vincent Hospital experienced a 10-month-long strike with 700 nurses starting in March 2021, and it was just the longest strike of the year. Jay, it would be great if you could give us some background on why nurses were striking at your hospital and how it all happened.
Sure, absolutely. I'm happy to do that. So as you stated, our strike started in March of 2021, and almost 800 nurses on one day walked out of the facility. Over the next following months, there were obviously multiple attempts to negotiate that fell through, and this went on for month after month, to the hospital leading up, even recruiting strike replacement workers just to be able to kind of fill the gaps in patient care and staffing that we were experiencing. An agreement was tentatively reached in December of 2021. That agreement was later ratified, and the strike officially ended in January of 2022 of this year. So as far as the reason for the strike, I think that really comes down to kind of who you ask, right? Everybody has a different viewpoint. The key in this nursing strike is that it's 10 months long. And that in a hospital is a lifetime, because especially in the last 2 years when we faced such rapid cycle changes, you look at 10 months and that is a lifetime in the hospital. And so for a lot of people, and that's on both sides of the strike, that's the people that stayed. We did have crossers, the people that were on the lines. I think that the real reason for the strike, it had a tendency to get blurry. And so again, if you were to ask 10 people, you might get 10 different feedbacks for exactly why the strike occurred.
Got it. And so what were some of the range of reasons that
Sure.
came
So
up?
it's not really different from what you hear today. Nurse staffing,
Yep.
and safe patient care, and those are struggles. As you made it quite clear that we're not only in right now, but we're going to be facing for the next several years.
Yeah. Got it. And so there were also at least 10 strikes in 2018 and 14 in 2019. I mean, there's the number of nurse strikes hasn't really changed year over year. And it's been fairly consistent before the pandemic and now as well. But nurses say that the pandemic brought on more stress, more challenges, which it did. Did the pandemic have any impact on the St. Vincent strike?
So I think certainly it certainly did. Healthcare is not an easy job, right? I mean, it's very difficult. It's always been very difficult. And we've always had some of the very, similar challenges that we're having now. I've for 20 years heard about nursing shortages. We've had supply chain issues, different labor factors that have always played a role in the hospital operations. But the pandemic significantly exacerbated these. And so you took a nurse staffing, which was, very fragile anyway. You placed a pandemic on top of it. Then you also placed, a lot of national scrutiny, let's just be honest, with the job that nurses were doing. So nurses at one time were feeling supported by members of the community, but then you had a whole nother sect that were like, we don't think this is real. This is not really happening. So as a bedside practicing nurse, it was frustrating for a lot of nurses. Then we had supply chain issues and, labor shortages. You had very sick patients, ratios that were higher than normal, significant patient loads. You had a lot of death and dying in the early days of the pandemic. And so absolutely, that was a driver of the nursing strike here. But it's not only that, it's the driver of a lot of discontentment right now in the nursing workforce. And one of the things you have to know is that nurses, they need to be heard, right? And they need to know that people are advocating for them and people understand the situation. And, as a chief nursing officer, one of my jobs is to make sure that, even though there are a lot of issues in the hospital, just like there are in every hospital, that I have to make sure that my nurses know that, listen, you have a voice. We understand where you're at. We get you, and we're doing everything that we can to make things better. Nursing in itself as a career choice is, we find ourselves being very innovative, right? We will always do whatever necessary to make sure the patient's taken care of. And you saw a lot of that in the pandemic, but nurses got to a point where they felt like they were not being supported. And certainly that can be an open door to strikes and, people changing jobs and other types of, labor interruptions.
Okay, got it. And so, ultimately, what was like the impact of the strike on the hospital?
Well, so it's significant, right? I mean, we had the compromised ability to care for our patients. When you have almost, 800 nurses that walk out on one day, that doesn't keep people from getting sick, coming to the ER, surgeries from happening, and there were still patients inside the hospital. So over time, especially through a 10-month-long process, there were nursing units that closed, different services that we had to close because we just could not staff them effectively. And so ultimately, it was patients that suffered in that situation because we couldn't provide care. You look at also, there was a lot of people here in the hospital that left the hospital, not necessarily because of the strike. We lost a lot of leaders during that time because, they're trying to do 15 different jobs, trying to hold things together, and it just became too overwhelming. And so you look at a hospital now that has probably a 70% leadership turnover pre-strike versus post-strike, just because, it was overwhelming to work in those circumstances. You had a lot of great nurses that were very solid bedside nurses, had been at this hospital for years. This is a Catholic hospital, so there used to be a school of nursing inside the hospital that the nuns used to run. So we have a lot of nurses here that were graduates of that institution. And some of those left just because it was too stressful to stay in the environment. So it's unfortunate. So you've got lost relationships, the reputation for the hospital is damaged. And then too, you have to look at the financial impact. There's a significant amount of money invested in strike replacement labor. And it's very widely publicized. The hospital spent over the course of the 10 months, $5+ million just on, extra police officers around the facility during the strike. And that's just one of multitudes of different expenses and challenges that we kind of had to walk ourselves through.
You mentioned earlier that you were even the permanent strike replacement workers that pause as well. Like, how did you actually get the staff to fill that gap during those 10 months?
Sure. So, there are companies, that specialize in this type of rapid response. And so that's what we did. We had to contact the company. And so during the strike, and, I was somewhat connected here at that time anyway, because, we worked for the parent company that owns the hospital. I was just in a different location of the United States.
Yep.
And, so that you had 800 nurses in one side of the facility getting ready to walk on and 800 nurses in another part of the facility getting ready to walk off. And so there's this, care transition that was going on, which takes an incredible amount of forethought, planning, because ultimately, you've got to take care of the patients and we've got to ensure patient safety. And so, it took a lot of coordination, a lot of people that devoted a lot of time from a lot of different hospitals around the United States to come in and to make sure the stage was safely set for us at the hospital to continue patient care.
Okay, so you mentioned the challenges of, you needed to continue to deliver care to your community and to your patients. You mentioned the reputational impact. There's certainly a financial impact. Like, how did you even begin to tackle these challenges?
So with any problem, right? You have to start where you're at, and you have to start with what you have, which sometimes is not the stuff that you need, but it's like, okay, here's where we're at, here's what we have, let's move forward. So initially, as we come into January, and we know sometime in December that we feel like the strike is going to be over. Then when the agreement is, ratified and voted on, we're for sure, okay, the strike is in and we're 100%, moving forward. Then there's a lot of unanswered questions for us because there's no guarantee of who's coming back from the strike. And so we have all this, resource labor on site. We have a question mark of nurses that are coming back. So we have to find out, okay, how do we get these nurses back in? How do we reorient them? How do we reabsorb them to the workforce? How do we make sure that we transition out all the contract labor? And have we transitioned out enough? Have we transitioned out too much? And so we're going to be short staffed.
Yeah.
There was a lot of kind of anxiety about some of the strike replacement workers. Are they going to lose their job because, we have strikers that are returning? And so there was a lot of questions we had to answer. And when you look at the return to work, there was a stepwise process for that. And so it's a lot of, organization, sending out letters to all the, at that point was 600 plus people. We made one Saturday, the leadership team got together and we made 600 individual phone calls to all the people that were still on strike officially saying, hey, are you coming back to the hospital? You're getting a return to work letter. And thankfully I think I made 60 calls. We had 10 people made 60 calls apiece. And so we spent a Saturday just making phone calls and, hand delivering letters, because it's part of the return to work agreement, and then trying to take those 600 plus nurses at that point and trying to reabsorb them back into the institution. So that was some of the initial challenges that we faced just in the return aspect from the strike.
Got it. So a few, I guess, tactical questions have come in just related to the strike. So Linda asks, did you receive a 10-day strike notice?
Yes.
Okay. And then how was the morale? You're referring to nurses in this conversation, but what was the morale of the other allied health professions and other hospital staff that were affected by this prolonged long strike by the nurses?
Sure. I think, initially, it's kind of two different pictures here. Listen, I'm a nurse advocate, right? I'm a nurse, so I'm self-advocate too. So I'm definitely advocate for nurses. So I don't think that anybody had an issue with nurses advocating for patient care, advocating for, what they felt like were unsafe staffing conditions. Mm-hmm. However, part of the challenge was they knew the nurses were going out, and then, it almost felt like, okay, so now we're absorbing a lot of that care. So I think that there was a lot of disillusionment is the right adjective to use here. A lot of disillusionment. Now, we are represented by multiple unions within the hospital, and there was a lot of the other unions that did, that were supportive of the strike. So I felt like, there was a relationship with the nurses. They supported the nurses, but there was a disillusionment about how does this affect my job? What does the future look like? And, what's going to happen? And obviously the first day of the strike, then you get in the second day and the third day, and then you get 30 days out and then 90 days out. And then it becomes a different challenge, right? Because the challenges that we dealt with on day one of the strike, or the hospital did, are very different than the challenges you deal with on day 90, or day 120, or 6 months into it. It's a very, very different battle. It's a very different kind of issue to manage 6 months versus day one.
Yeah. You mean just in terms of just what your team is communicating, or what the team is experiencing?
So it's different, right? So again, when I opened it up, I said, it's easy in 10 months for things to the waters to get very muddy, and they did get muddy because it became harder for the people that were here to understand what was going on. And it's almost like, the strike became just a norm. And, we talked about it a lot, but it's like, okay, it's just like that's a permanent fixture on the hospital, was the picketers and the signs. And it just became the thing you expect when you went by the hospital. And some of the nurses, especially those at Cross, became somewhat frustrated, I think, too, because, they were just, they're working as hard as they can, trying to keep the hospital together. And so it was a very challenging environment. And then too, I think that 10 months of, kind of headbutting with, negotiations and stuff is, felt like, I'm sure to both sides, that it was, an impasse that's not very productive.
Yeah, absolutely. All right. Thank you, Robin, for your question. Okay, so what are what are some of the labor challenges that you're tackling?
Sure. So, like most hospitals right now, right, we need staff. I mean,
Yep.
staffing. I was just talking to somebody today that works in regulation and does a lot of joint commission work, and we were talking about the staffing crisis. And this person obviously is well traveled and has just spent some time out in the Western United States and Arizona, and was just relaying the difficult challenges with
Yeah.
staffing. I've talked to one of my nursing friends in Florida that's over an entire market, just can't get staff. And so our challenges labor wise are really not much different than everybody else's. We need staff. We're challenged with staff. Initially after the strike, I mean, it was challenging for us because, we had the collective bargaining agreement that, we operated the hospital by. Then there was the last best final offer.
Yep.
And that was, hey, here's what we're going to offer. Then there was the return to work agreement. So you're managing three separate agreements with the people that are coming back, and it's very challenging, very confusing. And then you have to think about, as far as from a labor aspect, which nobody has to do this, right? You have to think about, okay, so if I have hired 10 strike replacement workers here in this area, and I have all 10 of the strikers come back, then I'm double staffed in this area. So what am I going to do with 10 extra nurses? And we can also, you can put them out on the floor, but what if they're an OB nurse? What if they are a same-day surgeon nurse? What if they're an OR circulator, who may not have the training or the skill set to be able to go and be an ICU nurse or a float pool nurse? And so there were a lot of those challenges that, we tried to address, because again, you don't know until January 22nd how many nurses are coming back officially. So we tried to theoretically address all those and put in systems. I don't know that we were really overly effective with that, because it was just a new challenge every day in the early days. And, too, as we look at, your question about labor, we had some attrition that happened, not only with the people that came back, but then kind of those people that kind of slowly, decided, okay, this is not the best thing. And, some left and some decided not to do it for a variety of different reasons. And I think some of them who were fantastic nurses, they loved the hospital that they left, but that hospital disappeared, right? That hospital doesn't exist anymore because it's 10 months later during a pandemic. There's no hospital that today is the same hospital that it was in 2019, or even in the first stages of 2020. We've all gone through transformation, good and bad. But and that's almost sad, right? That, I love this hospital. It's a great part of my life, and you come back and it's different people, different leaders, different everything, because that hospital's gone. It's never coming back again. We're in a different world. Healthcare is forever different. And we're just trying to figure out, the next steps to take forward.
Got it. Okay, so one question that came in from Laura and is, you mentioned that I imagine the relationship with the union was not great during the strike. And ultimately, what was that relationship like, and what did you ultimately have to do in terms of concessions to resolve the strike?
So yeah, it's not great, and it's still not great, to be honest with you. And I mean, and I think the union would agree that, there's still a lot of challenges. That's one of the things you have to look at is, we had to look at recovery reputation for the hospital, but then we have to look at, man, we've been fighting with this union for 10 months, and so, relationships are not going to be great. So I don't think that it was necessarily anything that we did to improve the relationship. It was just the fact that this was the reasonable thing to do to get people back engaged in the workforce. And it was just, hey, let's end this, let's meet on common ground. And I that's my opinion, obviously. Now, I will tell you, as a chief nursing officer, kind of, how I dealt with it. And that's basically that I focus on nursing practice, right? I didn't get involved in a lot of the union activities, and I still don't, right? I have what I perceive as a pretty good relationship with the union. They've always treated me well. I try to return that respect, because we're all nurses, right? We all are doing the same job. We're advocating for patients. And to be honest, in, the interactions I have, there's not a whole lot that we really disagree on. Let's just be honest. Now, what happens is that we tend to not agree about the methods to accomplish it. That's where we kind of get stalemated, in maybe the methods and stuff like that. And I never engaged myself with discussions on salary and compensation and things like that, because, I want to make sure as a CNA, I stay focused on nursing practice and don't get into all those issues unless it's, necessary for me to contribute to the situation.
Okay, so you've obviously done a lot to rebuild after the strike this year, since January of 2022. Like, has it worked? And, what's worked, what's not worked in the rebuilding?
So, I think everything's a process, right? And you have to develop the process and you trust your processes. And if you look at the process and it's not giving you what you want, you change your process. But with every process, there's been things that have worked and things that have not worked. And so we're continually trying to improve things. I will not say that, as we started in, let's say February, that, things were great. As a matter of fact, when the nurses came back from strike, there was a push within the nurses here to decertify the union. So, the strike ends and then we have a decertification vote they have to go through.
Yeah.
And so it's just like, let's just take another hit, which all, it's all the workers' right. You can be represented by the union. It's your right as a worker. I support that. It's also your right not to be represented by a union. I support that as well. So for me, it never changed the job that I do. My job is the same with the union or without the union, because I'm focused on leading nurses and patient care. And again, that goes back to the other question. You have to stay focused. So, there was no magic pill that made everything, wonderful. It's sometimes we learn things that we tried that didn't work, and that's okay. And it's fine to come back to a situation and say, look, we implemented this. It was a total failure. We messed up. We screwed up. We didn't do it right. So let's go back and try this and see if it will work.
Got it. I guess any particular reason why the thing that's unique about this strike is just the length of it as well, 10 months. Any particular reason why it lasted that long as opposed to being resolved in 1 month or 2 months?
I think that, again, that's a challenging question, right?
Yeah.
I think we could all look back and, my story and the story of the hospital is going to be very, very different than the story of the union. It's totally different sides. I think the union would say, we stood up for patient care and weren't willing to compromise. Fully support that. I think the hospital would say, hey, we stood up for, this was the offer, this is what we could do. So we're moving right along. And, if you don't want to be here, you don't want to be here. And so, you had two sides that were just, pretty dug into what they felt like was right. And, but again, I think that everybody would have a different opinion. And I don't know that really kind of benefits us to know that, right? I mean, I think that the big takeaways from this are, we have to make sure that our nurses are heard, that they're fully represented, and really that we will all have issues and we have to move on. You asked earlier about what's worked and what hasn't worked. And, again, part of the challenge with, bringing, the nurses back was, how is this going to affect our culture, right? I mean, and we were I was very nervous about that. And so one of the things that I really stood on, and this is one of those hills you choose to die on, right? And it was that we're all going to be a professional environment here. We're going to have to welcome these nurses back. There was an article when I first got here, one of the papers did, and the way I described how our attitude was, we're sitting here with open arms, and that's still the way I feel. But it's like, hey, we have to treat these nurses right. At the same time, they have to treat us right. And we stood on that professional conduct, and then we tried to move on. But for something that didn't work right, I was it was probably 2 months after the strike was over. And, somebody mentioned to me that said, hey, people are still talking about the strike and mentioning that if you have any problems with returning workers, that you should report that immediately. And I'm like, where's that coming from? And in orientation, some of the people, would say, hey, we're in a post-strike environment. And, if you have any problems, let us know. And I'm like, hey, let's move away from that. I mean, that was like 2 months ago. that's not where we live anymore. We're a family now, and we have to move on, because it can't be, these are the strikers and these are the nurses that stay. It's a dangerous place, right? Because we are one. Now, like any family, we're going to argue and fight and, not talk to each other for a while. But, listen, we're together. We're one person. Let's move past this and really focus on what kind of nursing group do we want to be? What kind of hospital do we want to be? And tell me about the care we want to focus, or provide to our patients. And so we changed that narrative and said, hey, welcome to St. Vincent's Hospital. We have a desire to be a very diverse and inclusive culture here. And we want you to be a part of that. And if you ever encounter anything that's not like that, then let us know.
Got it. Okay.
And so we just kind of changed the narrative around some things.
Got it. So let's go deep on nurse hiring, right? And the nurse hiring strategies that you implemented after the strike. So it sounds like, let's talk about the new graduate topic first. Like how did you tackle nurse hiring as it relates to new graduates?
So, recruiting is a challenge at any hospital. I'm sure people are on this, webinar to, because they're facing similar things that we are, right? We can't get the nurses. We don't know where they're at. We're struggling every day. So, and recruiting's difficult, right? So we are doing several things. So we have reshaped kind of our recruiting mechanisms, because what we were doing was outdated and was not working. And, we can't recruit like we did in the 90s or the early 2000s. We can't even recruit right now like we did in 2019, right?
Right.
We have to be just very, very different. So we changed those methods. But we have to have, I think every nurse leader probably is going to have this epiphany, if you will, that we don't have the nurses out there. I heard somebody say that there were the nurses out there, but they're not in the workforce. So they may be on the beach or something. I don't know, another job. They're not in the workforce, which doesn't benefit me if I'm trying to staff the hospital. So they're not there. So what's our options? Well, we can't create nurses. So what do we have to do? Well, the only people that are creating nurses are nursing schools, right? Colleges. And so we have to have this epiphany that our future is going to lie probably in new graduates. And so what we did is we're still relying heavily on contract labor, like most hospitals. We are revamping our recruiting process. But then too, my focus as a chief nursing officer has really been, let's really reach out there and develop some programs within the hospital so that we can not only recruit new graduates, but train those new graduates so that they can take very good care of our patients. Now, mind you, we have not had clinical rotations in this hospital for 2 years. 1 year for the pandemic, and then 1 year for the strike. And so you talk about when I got here, we were out of touch to nursing schools. And so my strategy, and it's Massachusetts, right? There's a college on every corner. And just like there's a lawyer on every corner here too, but that's a different discussion. So, so I was very fortunate to have some fantastic schools within just like arm's reach of where I'm at. So we went out and built relationships with those. And, I'm serving on like the nursing advisory boards of 4 of the 5 to 7 colleges within the area. And which is something I love to do, right? I love to engage, with talking about nurse career paths and things like that. And we develop new graduate programs here. We've got a robust clinical program here. We're going to be offering clinical 7 days a week for nursing schools. And, we really are developing a fantastic program here because we know that new graduates are our future. And it's not, without risk, right? And, back to one of your early slides, you mentioned about the big gap in, how many nurses were retiring and moving out of the workforce. So we can replace body for body, right? We can, recruit new graduates and stuff like that. What you can't do is replace this knowledge and experience gap. That is the biggest threat to healthcare right now. I think we can, in a couple of years, at least start replacing body for body. We may still live a little bit behind, but this knowledge experience gap is the challenge. How do we feel, nurses that have 25 and 30? I've got nurses here that have been here 41 years. That never happens, right? 41 years at one facility. And how do you take that 41 years of nursing knowledge and experience and all these things that they have and pour it into the head of a 22-year-old brand new nursing graduate? So that's really the challenge that we're facing in healthcare for the next 2 to 10 years.
Yep, absolutely. Okay, so how many new grads do you typically hire per year? And what's
So,
their training as well?
yeah, so we typically will hire, between 30 to 50 new graduates per year. And it depends really, it's all varied on the market, right? And where we need nurses. But right now, if you told me, if you say, hey, look, I've got a deal for you, I'll give you 150 new nurse graduates, I'd hire every one of them,
Yeah.
because I have that kind of need. So I think, as a percentage wise, you look at your workforce is 10 to 15% new graduates probably at any given time,
Mhm.
which is pretty good numbers. It means that you've got 80% of your nurses that can train those 10 to 15%. The problem is that I think that I probably will look at a hospital and say, I've got 50% new graduates. So again, we go back to the original problem, the knowledge experience gap. And so we have to figure out a way to mitigate that. So a couple of strategies, if you don't mind, if I talk
Yeah.
about that we've kind of implemented with the nursing schools are two. Well, really three. The first one is student nurses, right? Or nurse externs or whatever you want to call them. Hiring these nursing students into positions in your hospital in the units that they want to work in. Now, back when we had staffing, I was, in my many iterations as a nurse leader, there's one time I was a manager of, in critical care and then became a service line director. I would always hire a few new graduates into critical care. Now, they had to be like really boom, top performing and stuff like that. There were some areas that we wouldn't really hire new graduates into because we wanted to get some good nursing experience first. Those days are gone, right? I mean, so you have to look at nursing schools and say, hey, you want to be an OR nurse, an LD nurse, a postpartum nurse, a NICU nurse, or whatever, then okay, let's make that happen for you because there's just no ability to put them anywhere else. So hire them into the area to work as a student nurse, which means, essentially PCA or PCG type work, but at least they get familiar with the area. They begin to, hear things that they're going to learn about in school. They begin to understand things. Secondly, is partnering with nursing schools. And we've done what we call dedicated education units, which is, as far as evidence-based practice, if you are in the academic field, you'll understand what I'm talking about. So a dedicated education unit is this. It means that we have one unit in our hospital that is dedicated to X college. And so X college sends all their student nurses through this unit for their entire time in nursing school. So there's not this kind of gap in clinicals, to know the facility and try to get into the facility. We're guaranteeing these schools, you can have all the clinicals you want on this floor here. And so they develop a partnership, the nursing instructor with a unit manager, the nursing students with the nurses on that unit. And so they're getting this robust clinical experience that they begin to kind of, they understand the people, they understand the patient population, they understand the policies and procedures and the workflow. And so they're able to have a more robust clinical experience. Again, trying to decrease that knowledge experience gap. We also have opened up all of our specialty areas for clinical rotations because we want these nurses also to experience the OR, the cath lab. And so they'll rotate through there as well. And so again, trying to give them as many touches and as much clinical experience as we can. And then we developed a really robust mentorship program post-graduation so that you spend a year just being mentored, not only just in your, particular unit role, but you also are mentored from a nursing culture standpoint. And, we put you through a lot of different experiences so that we hopefully can shape the culture of the hospital and really make you a nurse that's not just siloed, but you kind of understand how the organization works.
Got it. Okay. We want to make sure we cover the topic of flexible scheduling, compensation, and then hear your lessons learned too. So on the topic of scheduling, that's the second most common reason that nurses are citing in terms of why they're leaving, or why they're changing jobs. The topic of scheduling internally, and how does it work at St. Vincent today?
So we are an organization that's a typical hospital, 12-hour shifts, right? 7A, 7P, 7P, 7A. We are opening an 8-hour nursing unit. And so to try to give people, some options, right? And 8 hours may work, I wish I wanted to get a career where I have an 8-hour day, but I don't think that those exist when you're a nurse leader. But just to give people some options. We also have some other things that I can't go into because obviously I have a union obligation here, to really look at some different flexibility, different schedules, You know, and especially some of the areas we do have a lot of flexibility, like the emergency department, you know, that has a lot of flexibility for different schedules. And so we're trying to get nurse leaders to think creatively.
Yep.
And we think creatively too a lot with our students because, you know, they've got to go to school and do clinicals. And so we think creatively with their schedules. Why not think creatively about nursing schedules too? You
Mhm.
know, this was my thing on the holidays. You know, because, you know, as nurses, you know, we work Christmas,
Yep.
New Year's, Hanukkah, Kwanzaa, whatever your holiday is, we're here, right? So my whole thing to my nurses was, hey, you may schedule to work Christmas, doesn't mean you have to work the entire shift of Christmas. You know, take 3 people and work 4 hours apiece for your 12 hours, you
Yep.
know, and schedule your Christmas around that or your holiday or whatever. And so we have to kind of think outside the box.
Yep.
And oddly enough, we were in a discussion earlier with the team here about, you know, what sets us apart as a hospital. Because here's the reality, and I know people can relate to this. I'm about a 300-bed hospital. We're a for-profit hospital. I can throw a rock and hit UMass. And UMass in our city has 2 big hospitals. University Hospital, which means what? Not for profit. The footprint's bigger, the recruiting's bigger, the pay's probably better. I'm 45 minutes from Boston. I know, you know, if you're just joining, I'm confusing you because I'm in Massachusetts with a Southern accent. But so
Yeah.
45, I can get to Boston in 45 minutes. You might take you a little longer. So in Boston, big hospitals. I mean, you know, like these are the hospitals people write about, right? I mean, they only write about St. Vincent because we had a 10-month nurses strike. But these hospitals in Boston, they're writing about because they're doing all this great stuff. You know, not that we're not doing great things, but they get a lot of great publicity, doing all kind of research. You could work there probably for more than I can pay you. So I'm challenged, you know, because I have to say, okay, what makes people want to work here? You
Yep.
know, and so you have to look at things like, is the free parking here? We have in our hospital, we have a covered parking garage for all employees, which is great because it does snow here, right? We didn't have this
Yeah.
problem in Alabama. And so it's like, hey, well, that's a benefit, right? You know, and it's, you know, maybe it's $5, I think, a month to park or something.
Got it.
So it's just crazy things you never thought you'd have to look at. You have to look
Yep.
at those things.
Yeah,
And then
absolutely.
the thing I love is career advancement in nursing. You mentioned that. That's something I really, really like. And I'm very engaged in that, in offering the nurses the ability to grow professionally and grow, you know, as far as, you know, opportunities in the future.
Yeah, absolutely. The ideas and tactics that we hear from nursing leaders across the country, just on the scheduling topic, includes self-scheduling, weekend options, certainly 8-hour shifts. Really, it's just like a menu. It's just the menu options, and it really does help. It's helping retention as well as hiring. It's great. Okay, so you know, the topic of compensation is going to come. It always comes up. So how do you think about building compensation packages for your nursing teams?
Well, you know, of course, we're in a position as a union hospital, we have to negotiate all that. But I mean, I think that you always have to look at that. You know, we were, you know, I was mentioning earlier today about a compensation package for not nurses, but a different clinical specialty, because you have to always be aware of what everybody else is paying, right?
Yeah.
I mean, you do, and you have to say, okay, so, you know, here's what the rate is, but, you know, are our benefits good? You know, is there a childcare option? And you have to think about the total package of not just, you know, getting the nurse in the building to take care of your patients. You have to realize this nurse has a life, and what can I offer them to also give them some type of work-life balance? Because the things that you're mentioning are what they're after, right? They love nursing, they love to take care of patients, but they also love, you know, seeing the hospital in the rearview mirror. It's like, you know, bye, because I'm going home. And so you have to give them some options that can make their schedule flexible so that they can have some type of work-life balance. And so I will say this about compensation: it's always a puzzle that you're trying to figure out, because, you know, even when you think you have the right answers, you don't. And it's hard. It's very, very difficult right now. And there's nothing I'm about to say that's going to make everything. I know, be on the
Everyone's
interview,
looking for
there's
answers.
nothing that I have here to solve your problems other than it's challenging, and it's all area dependent too, right? It depends on what you're facing in your area and the challenges that you're facing at the moment, you know, based on labor, other hospitals, and things of that nature.
Got it. Okay, so we're just going to quickly review what is Incredible Health and what we do to support hospitals and health systems, and then the rest of the time is going to be for Q&A. There are quite a lot of questions that have been submitted, so we're probably going to go up to the top of the hour. So Incredible Health, hospitals use our custom matching technology to hire high quality permanent nurses in less than 20 days. We work with over 500 hospitals and health systems across 25 states. We work with very big systems like Kaiser Permanente and HCA. We actually do work with the Tenet system too in South Carolina and in Florida. We work with many regional systems as well, like Beth Israel Lahey and Baylor Scott and White and Wellstar, and lots of academic medical centers as well, including Stanford and Cedars-Sinai, Northwestern, NYU, and many others. So at this point, we're accustomed to working with all hospitals, almost all types of hospitals and health systems, including for-profit, nonprofit, and as well as union and non-union facilities. So the unique thing about us is that there's three things that are unique about Incredible Health that differentiate us. Number one, the employers apply to the talent instead of waiting for the talent to apply to them. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax, and they get interview requests from, UMass, St. Vincent, Beth Israel Lahey, et cetera, and they get to choose which interviews to accept and which ones to decline. We've also automated the screening of the talent, so we're automatically verifying things like licenses and malpractice set records and certifications and so on. So really serving up high quality talent. And then the custom matching algorithms is what we built as well. So it's a highly personalized experience for both sides. If you are a highly sought after ICU nurse, you don't really want to hear from 100 employers. You want to hear from 4 or 5 that meet your preferences and your specifications. And it's the same for the employers. The nurse recruiters in the Boston area or your facility might have very specific requirements and needs, and they have very specific location as well. And so that's what the matching algorithms enable. So they don't, that nurse recruiter shouldn't see 200 nurses. He or she should just see 10 or 15 a week. And then this is all supported with a very robust set of data analytics where we can see how nurses are proceeding through different steps in the hiring process. Nursing leaders and HR leaders use our data to really just drive process improvement and operational excellence internally too. And I saw that there was a question that came in that we'll discuss as well from Michelle about what we do to measure and what we do to drive accountability too. We also provide a whole range of free tools and services to the nurses. Nurses use all of Incredible Health completely for free. We have free continuing education, which is accredited in all 50 states. Which is accessible in our apps. They also use our salary estimators if they're trying to do some research on salaries in different parts of the country. Every nurse who signs up gets a career coach or a talent advocate. We also have an advice platform for nurses where they can ask each other very specific questions. So for example, an ER nurse who's looking to expand his or her ER skills, we automatically ping our database of ER nurses and they come in and answer the question in a very precise way. And then lots of career resources as well. Just wanted to share a little bit more data with the audience here, and we'll chat about this in a moment with Jay, but just, the importance of speed and having really strong internal hiring operations really is a competitive advantage. Health systems like Tenet and HCA, the for-profit systems really do excel in this area. 68% of nurses on our platform accept the very first offer they receive. And 61% of them receive accept the first offer, even if the second or third has higher compensation. So yes, you might be in a market where the employers around you might have a bigger brand or a bigger footprint or higher compensation, but there are many teams that their competitive advantage is actually their extremely streamlined and rapid hiring operations, and they are actually the ones that are hiring the most. This is just a quick case study just from a team in the LA area. We have the different steps of the hiring process, and where we're really having the biggest impact is on time to source. So with conventional hiring, it's 44 days. With Incredible Health, it's just 3 days. We are removing a few days in later steps of the process because we automate things like interview scheduling, for example. And so ultimately, we're really trying to bring down the days to fill. For this team, we were able to bring it down from 66 days down to 19 days. And then, every nursing leader cares about retention. We do measure retention. And when nurses are hired through the Incredible Health platform, the retention rate is 15% higher than the baseline. The reason for that is because the nurse was able to consider multiple opportunities before selecting, your hospital. So it was a very well thought out job search, as opposed to just taking, the first thing they could get. This is how we, collaborate. And this is just everybody has 8 steps in our hiring process, roughly, from sourcing to pre-screening to getting interviews done to getting offers out and accepted. And just it's a true partnership with an internal talent acquisition team that's already in place. So Incredible Health, we're doing a lot of the heavy lifting in the beginning, the sourcing, the pre-screening, making sure they're actively looking and getting that first recruiter phone screen automatically scheduled. At that point, the hospital's in-house talent acquisition team is taking that talent through their regular hiring process, completing phone screens, getting interviews completed, getting offers out, and getting offers accepted. This is really a newer model in talent acquisition, where we really, many HR leaders and nursing leaders are looking at this and thinking, we need to ensure that recruiters are doing what they're doing, what they should be doing best, right? Which is speaking with candidates, building relationships with candidates, building relationships with hiring managers, and really kind of reducing some of the administrative work, like sourcing, for example, and allowing technology like Incredible Health to do the heavy lifting there. So to really free up recruiter time to do what they do best. We do talk a lot about ensuring that nurses operate at the top of their license, but nurse recruiters also need to operate at the top of their skill set too. All right, so we'll go into the Q&A from now until the end of the hour. If there are any additional questions that come up, please feel free to email us at questions@incrediblehealth.com. Either our team or Jay will help get them answered. And then a member of our team will also be in touch with the recording. And then we just shared, if you wanted to sign up for a demo and want to find out more about Incredible Health, we did share the link as well. All right, so let's dive into some of these questions. Okay, Jay, we got a question from Michelle. When it comes to the topic of nurse hiring, how do you think about performance metrics? Things like vacancy rate and days to fill and speed and things like that. And how do you and how are you driving accountability with your nursing managers as well as the HR leaders?
I think if we looked at vacancy rate, we would all fail right now. So I don't look at that because it looks so bad. But I think that there's a key thing in this question here, and that is, and you highlight actually on one of your slides, which is the turnaround time, right? From the time the applicant, applies to the time the applicant gets an offer. And, this is a process in every hospital that's wrought with delays. And so that's what we would that's one of the things that we follow is from the time the person put in the application to the time they're able to get processed, interviewed, and actually get an offer and start. And when we did that evaluation, we found there's a lot of gaps, and we mitigated that by putting in some, measures that would try to turn that around. But, that's something I micromanage along with our HR department as we look at each week. Okay, how many candidates applied? How many did we hire? When we do a hiring event, we look at, did everybody get an offer before they walked out of the facility? And we're not talking about just, hey, we want to hire you, because I want to hire everybody, right? Everybody gets that same offer from me. So if there's nurses watching you're hired, I just need to figure out all the schematics about it, like how much you make and things like that. So that's some of the things that we look at is really the process, and to make sure the process is streamlined and that people are getting interviewed timely and an offer timely.
Got it. One of the top challenges that hospitals and health systems face is the nursing managers, ensuring that they're able to interview and make offer decisions quickly. But the nursing managers are really busy, right? Like they're on the floors, they're managing their teams, they've just got a lot going on. How do you think about that challenge, like of ensuring your nursing manager interviewing, but they're also extremely busy with other tasks?
Sure, a couple of ways is team interviewing, right? Which is, you may have one nurse that for that day is going to be the designated go-to person for interviews. Now, this involves a lot of stuff. It involves trust, right? And it involves that nurse leader being at least well-versed in what your needs are. Because, interviewing it's not that complicated, right? Because we can, talk to somebody pretty quickly and understand if they're a fit. What may be challenging is determining if they're a fit for your particular area. And so, that involves a lot of communication. Some of the hospitals within our market have done this. They've designated one person for 30 days to do all the interviews. And they can do my service line if you're a large hospital, or, say, hey, we're doing all the med-surg tele, we're doing critical care and ED here, and I'll interview 100% of the people. And so you take them out of their role if it's an educator or whoever this person may be, and you put them in that specific recruiting role, because you are correct. Nurse manager's time is very, very challenging, and they're trying to run the unit, deal with problems and issues, and at the same time, hiring and doing all that. So that's some of the things that we do to try to help that, but we've not got the perfect solution yet. We work at it every day to make sure that they've got the appropriate support that they need.
Yeah, absolutely. Yep, those tactics are used in different parts of the country. Allocating backup hiring managers is a common one. Centralizing the hiring, like you mentioned, like just having designating individuals to hire on or interview on behalf of an entire service line. Yeah, those are all great tactics. Question from Stephanie. You mentioned earlier in passing, Jay, that you're quite passionate and excited about career advancement for nurses. You talked quite a bit about the career advancement or the career training and work for new graduate nurses, but what do you have in place for some of your more tenured nurses?
So that's a great question. So, when I talk to new people that come to the hospital, I have this, I give the same speech like every week, right? And one of the things I say is that, my vision for nurses is that nurses can practice within the full scope of their licensure potential. And so our hospital is a medical education facility too. So we do a lot of medical residents. Yep. And so I think we should do the same for nursing. So my goal is to kind of get us there and, as in the practice of nursing. So whether it's, attending a seminar, working with one of our local colleges, taking these nurses, especially as, the question is those that are more advanced in their career. Here's what I need. I need you to take that knowledge and pour it out to some other people, because you're not going to be here forever. These people need it. They need your knowledge and experience. And so to give them platforms to be able to share their knowledge, to contribute to how the hospital runs. We're launching a nurse practice council here because, I have to make decisions every day that affect patient care at the bedside. Yep. And the most qualified person, is not me to do that. Believe it or not, it's the people at the bedside that I need to get feedback from. Hey, will this work? Does this really, I know it looks good on paper, but does it translate to the bedside? Because if it doesn't translate to the bedside, then there's a problem. Yep. So you just look for opportunities like that for these nurses to kind of recontribute their knowledge and their experience to the wider workforce. And, you offer things like, various certifications and things like that. And, new opportunities to work in different nurse modalities. And, there's a million things because, nursing is so varied, and we have a million opportunities before us, and so we just try to capitalize on all those.
Got it. Okay. Question that came in from Gloria. This is just advice for union negotiations. What tips do you have for encouraging unions to consider the other shifts scheduling options? You mentioned the 8-hour option, for example.
So I think that typically the unions want to do what's best for their nurses and the people they represent. So I never take anything to them that I don't think is going to benefit either nurses or patient safety or patient care. Yep. And listen, I'm happy to be questioned by them and say, hey, why do you want to do this? What's the reason? What's the goal? And a lot of the things that we've offered, people have interest in. And so sometimes if you're reaching an impasse, it's sometimes you can poll the nurse and say, hey, who's interested in this? And a lot of times that's what they look for is just, are the people they represent actually interested in this? Or is this something the hospital is just imposing because it's beneficial to the hospital?
Yeah. All right. So in our last minute, Jay, what would you say are your top lessons learned or the top tips you have for the leaders on this call?
So I had these tips that I think that were my lessons learned, and that's always do this. You want to keep the main reason, like that old analogy, keep the main thing the main thing. Always focus on the most important things. Love what you do, right? Lead from a place of love, even though it can be, you're putting out fires every day. It's awful. Your problems are just an opportunity. And so you have to look at them like that. And always trust your processes, because your processes are always going to determine your outcomes. And that's things I try to live by. Like everybody, I have to repent sometimes because I break my 4 commandments, but that's typically my lessons learned.
Got it. Thank you so much for being with us today, Jay. Really, really appreciate your time and your tips and your strategies and tactics that you've shared with all of us. For those of you on the call, we will be sharing the recording. Member of our team will be in touch. And thank you everyone for joining.
I appreciate it. Thank you.
All right. Thanks, Jake. See you.
All right. Bye-bye.